Hello guys, in this video I have quickly talked about the pulmonary hypertension and some of its causes. So if you learn these equations, it will become super easier for you to learn its causes. So delta P is basically the pressures and that drive the blood from the right side of the heart into the left side of the lung all the way to the lungs there. So this delta P is equal to pulmonary artery pressures minus pulmonary vein pressures, and while it is equal to Q multiplied by R, while Q is basically the cardiac output to the lungs and R is the resistance. So now look at this, we will just basically rearrange the equations, and now this is the final equation that will help you to remember the causes of pulmonary hypertension. So the first thing is the increased cardiac output will increase the pulmonary artery pressure. So it will basically cause the pulmonary hypertension. So the cardiac output can be increased if there is left to right shunt, if the blood from left side of the heart goes into the right side, and that blood will then definitely go into the pulmonary artery, so it will increase the pulmonary artery hypertension. So some of its causes are ASD, VSD, and PDA. Other causes are the pulmonary veins or pulmonary vasculature resistance. This resistance can be increased in case of some drugs, amphetamines, cocaine, BMPRT mutation, and some other causes that I haven't listed. But still, if you remember this equation, you can easily fit any cause of the pulmonary hypertension. Then the third cause is increase in the pulmonary veins resistance or pulmonary veins hypertension. So definitely this hypertension will bake into the pulmonary arteries, and it will increase the pulmonary artery hypertension. So some of its causes of the increased pulmonary vein resistance or increased pulmonary veins hypertension is left-sided heart failure, especially the valvular or valvular heart disease, are some of the heart failures in which there is decreased cardiac output. So this blood basically pull back and it result into the pulmonary artery blood pressures.